Did you know that Texas consistently ranks in the top 15 for statewide obesity, with 35.5% of our citizens being obese? It's not just a Texas problem, though. According to the Centers for Disease Control, 36% of U.S. citizens are classified as obese, putting our country in the top 10 for global obesity rankings. While these may seem like statistics, they're more than that. We're living through a crisis affecting our health, economy, and future generations. Obesity isn't just about personal choices, it's a societal issue with profound implications. Obesity has consistently been a public pressing health issue in the United States, but especially here in Texas, and it's time to make some serious changes or those that you love and yourself will be at risk. This is something that hits close to home for me because when I was younger, I witnessed my dad stop talking and collapse to the ground as he had a stroke. A man who I thought was invincible and had never even struggled with obesity almost died in my arms. At the hospital, the doctors were quick to say a poor diet and improper eating habits increased his odds of a stroke happening significantly. So growing up, weight management and heart health had always been important to me. As someone who's seen what improper eating can do, I'm a big advocate for maintaining a proper diet and staying fit. I've done extensive research on this topic and I've spoken with multiple cardiologists as I've grown up, knowing I'm more susceptible to heart health issues. In order to cover this topic comprehensively, I'm going to talk more in depth about the scope and the consequences of the obesity problem here in Texas. Then I'll discuss the government's role in being an agent for change, and I'll speak on a plan to reduce obesity and the benefits that it would bring to us and to future generations. So obesity is a major continuous public health issue here in the United States, but especially in Texas, and it's time a policy change is needed. To understand just how big the problem is, it's important to get a clear definition on what is considered obesity. Then we can look at the scope of obesity and its consequences. So obesity is characterized as excessive body fat. In order to be considered obese, you must have a BMI greater than or equal to 30. BMI is short for body mass index, and it is a measure of body fat based on a man or woman's height and weight. Now, how big of a problem is obesity? According to the United Health Foundation in Texas, 35.5% of our citizens are obese. And to break this down further by age, 31.8% of people ages 18 to 44 are obese, 42.7% of people aged 45 to 64, and 33.1% of people over 65 are all obese. If you break it down by gender, 34.4% of men are obese and 36.7% of women are obese. So on average, we see about 1/3 of our population facing obesity issues. One of the biggest problems with obesity is the physical health risks that come as a result. Risks include heart disease, stroke, type 2 diabetes, high blood pressure, certain cancers, and sleep apnea. All of these reduce life expectancy and mortality rates due to their chronic nature. There's also certain quality of life and mental health issues that come with obesity. Limited mobility impairs daily activities and disrupts social connections. You're also significantly more likely to face discrimination and stigmas, leading to low self-esteem and poor mental health. Not only does obesity impact the individual, but it also affects you through the toll it takes on our economy. It poses a significant economic burden on the healthcare systems and society as a whole through increased healthcare costs, reduced productivity, and disability services. Okay, so now that we know just how big of a problem obesity really is and the side effects that come with it, let's look at an agent that could help foster change for a healthier society. While it may seem like the best agent for change in obesity would be found in the private sector with organizations like the American Heart Association, they'll not be able to have as big of an impact on society like the government would be. So I believe the government would be the best agent for change in a situation like this. It's a government's responsibility to look out for the best interests of its citizens, and I believe right now they're failing in handling this epidemic properly due to obesity being normalized. However, they're the only real group that has the ability to make changes of significance on such a broad scale. For example, they can implement policies that create environments conducive to healthy living, from urban planning to education and healthcare initiatives. In the past, according to the National Library of Medicine, previous initiatives like calorie labeling and nutritional guides have had mixed success rates, with highlighting for the need of a more targeted and comprehensive approach on obesity management. So we have an agent for change, but we know the government isn't doing enough, and its track record for changes to help the obesity problem has only seen mixed results. Taking what we've seen In the past, the government can learn from their previous experiments and implement a three-part plan called the Comprehensive Obesity Prevention Act. The first part of this plan is education. It'll be required to include comprehensive nutrition education programs in schools and workplaces. Many obese people start putting on weight in their teenage years and midway through adulthood. So by reaching out to children and young adults, this is the first step in preventing obesity. It's also important to educate adults so they know how they can change their diets to prevent or remedy extreme weight and obesity. While education is a great starting point, it can only take us so far. The second part of this plan involves stricter regulation on advertising unhealthy foods to children and putting a tax on fast foods and unhealthy foods deemed by the state. One of the biggest problems we face is marketing candy and unhealthy foods to children, in turn making them eat more and more and leading to childhood obesity. This plan aims to reduce marketing to children as they're impressionable and may not be aware of the consequences that junk food could lead to. A tax could also be put in place so that when you dine at fast food establishments or buy junk food with certain levels of sugar and unhealthy ingredients, you're required to pay more. Fast food is oftentimes cheaper and easier than going to the grocery store, so it's widely accessible. However, it's very unhealthy. And by imposing a tax on unhealthy items, it'll deter people from consuming these foods as often. For the final part of this three-part plan, there's a focus on community engagement. The government can invest in community centers and public spaces that promote more physical activity. Right now, the National Center for Health Statistics says only about 46.9% of adults, less than half, are meeting the guidelines for aerobatic physical activity. By constructing more community centers and areas that focus on physical activity, this number can significantly increase and make working out more accessible and fun to everyone. So we know obesity is a massive problem here in Texas, with 1/3 of our citizens suffering. And by using the government as an agent of change, a three-part plan consisting of education, regulation, and community engagement will help remediate the problem and improve future generations with obesity management.